Every year in the United States, there are 6 million pregnancies. Could I have someone guess what percentage of these were accidental? The answer is over 50%. That's double what other developed nations have. Contraceptives play an important role in almost every woman's life in America, and yet 19 million viable women in America live in contraceptive deserts, where there's less than one provider for every 1,000 women. My name is Sarah Williams, and today I will be discussing why the Senate needs to increase funding for Title X. There are drastic changes going on in the White House right now to change Title X, which is the funding for low-income family planning and allowing providers of healthcare to discriminate who they provide services to based on religious affiliations. The legislation seeking to alter Title X right now, as you all know, includes taking out confidentiality for patients, which will lower the number of some adults and teenagers being able to seek out help for family planning. 6 in 10 women report that Title X programs are the only medical services they receive for that entire year. There are several other uses for birth control besides just a contraceptive. 1 in 10 women suffer from conditions like endometriosis or PCOS. For women who have endometriosis, birth control will slow symptoms and is effective pain management. For PCOS, there is no known cure, but the most effective treatment for women has been using birth control to manage symptoms. Providing availability and healthcare coverage for many women in America who are undiagnosed, which many are in early years, is a need like any other medical condition. Having better access and coverage for birth control could decrease the foster system in America. In 2016, there are nearly 700,000 children in foster care, and the average time these kids spent in state care is at least 2 years. More than half of these children are people of color, which seems to revolve around the low-income problem with family planning in America. Increasing funding for Title X, which has remained the same for 40 years despite inflation, is a fundamental right for women in America. Not only will it reduce unintended pregnancy rates in low-income areas, but can decrease the rate of children introduced into foster homes and help the painful systems of ovarian conditions. So help increase funding for Title X today.